Greetings, everyone, and welcome to our extended event. We've got the masterminds behind the masterminds. Thanks for including me in this fantastic conversation. I think this topic about working family caregivers has been, goodness, it's been a passion of mine way back in 2015 when I wrote my master's degree thesis at Gonzaga University. And for the 10 of you to pick up this topic almost 10 years later, I'm so excited to not only be with you, but to learn what's new in these last 10 years. So thanks to everybody for joining. Thanks for being a part of the Whole Care Network. And Kimberly, let's introduce all the masterminds behind this project.
Yeah, I'll do a short story of how the mastermind even came together. So back in 2022, during the month of National Family Caregivers Month, we were all together in person, most of us, and we recognized that there was a passion amongst a lot of us leaders in the care economy who felt like supporting working family caregivers was extremely important to us and important to the work that we were doing. So this was at an event called the Care Colloquium, and we decided to start some mastermind groups after that event. One of them being this supporting employees who are working and juggling care and career. And this group just took off and started doing some incredible behind the scenes research and work, and ended up doing some data collection through some focus groups with HR leaders. And it landed in this beautiful white paper that was authored collaboratively. And so we are here to talk to everyone about what this paper says and answer questions from HR leaders and care leaders alike. Paula, I'll pass it to you.
Yes, thank you very much, Kimberly and Chris, for that welcoming introductions. We are a group of professionals working with and supporting family caregivers and those that they care for. And we were really curious about the perspective from the employers. What did they know? What did they know? Do they recognize family caregivers within their workforce, or they're just other employees? And what are they doing to support them, if anything at all? Caring has changed because the baby boomers are aging in greater numbers, the need of a dual income household, consequences of the pandemic, and many other reasons. So we set up to interview 10 HR leaders. We asked them questions, we collected their answers, and also we compared their responses with our own research and our professional experience. And as Kimberly said, the result of all that effort turned out to be our white paper, which link is in the chat, and also all the information of the panelists here is in the chat as well. And we will be answering all your questions. Please put them in the chat. We want this to be as interactive as possible. So let's get started. And I'm going to, we will start with the panel discussion. So the first thing that we asked our HR leaders was, do they have any knowledge? I mean, what do they understand by the term family caregivers as defined by ARP and the National Alliance for Caregiving, which is a family caregiver is someone that gives unpaid care to a family member. It could be a family member or a friend, but it's an unpaid care and they are not healthcare professional. So our HR leaders really realized, they understood that family caregivers care for spouses, partners, children, adults with disabilities, and aging parents. So after that, we move on and ask them, what are the realities of family caregivers within their workforce? And then Elizabeth and Consuela, would you like to share with us what we learned from the HR leaders and also your experiences of working with family caregivers and supporting them as well?
Yes, thank you, Paula, and welcome everybody. And it was not shocking that HR leaders know about caregivers, the 53 million that are out here, that they are aware that people are caring for family members. But it also showed the diversity of their knowledge of the level of caregiving that is taking place. And I think it shows that it can often be limited and narrowed by their own personal experiences, which does lean a lot to them being supportive of working caregivers, but in some aspects, depending on their personal experience as a caregiver, it often clouds or limits what they perceive as being the needs of those who are working and caring. And I feel that was seen in the comments and in the feedback from the leaders, that they may feel that what they're doing is adequate based on their level of involvement at the caregiver level, in the boots hit the ground level. Like maybe they were just paying to support someone else who was actually doing the caregiving, and really limited on what it really means to be on the ground in the trenches doing the caregiving, and without a broadened perspective of what does really caregiving mean, what are the challenges, it may have diminished what they feel is a need of someone who is caregiving, and how that can affect how they show up at work. Because their needs of the needs of the different caregivers can vary depending on a lot of factors, socioeconomic factors, even cultural needs within certain people groups. It really is different depending on the lens or the things that are needed or required to be done in a particular group. And getting them to really think about that and sort of look outside of the box that they're in is something that we are really hoping is going to happen. And Elizabeth, I'll let her jump in and share more information about this.
Thanks, Consuela. Yeah, we learned a lot, I think, from the HR leaders. And, I think some things maybe didn't surprise me in particular about mostly females. They put their ages between 30 and 40, and that they recognized that they had a lot of impacts to their health and happiness. And that they really thought about how somebody in an hourly or a lower income role would have even a greater impact on them due to, care is expensive, and the financial impacts of that on people who are already kind of just making it. I think, they definitely saw that. They definitely also kind of were upfront that, they haven't collected the data specifically around family caregiving, but rather they're kind of pulling it together from different sources. Like people are self-reporting that they're a caregiver, or that they are, having maybe their employee resource group, if they have one, that's focused on the caregiving community, really using them to kind of tap out some valuable data. And maybe some of the benefits that people are using, they're kind of making some inferences. But what was definitely one of the things that we saw as a recommendation that came forth from these HR leaders is that we wanted to really advocate for them to do some accurate measurements, and maybe really, like Consuela was saying, understand your particular demographics of, how people age-wise or racially or socially, economically are being impacted, and target your programs and your things that you're going to offer to that family caregiving community, making it specific for the people that need it. And, I'm really pleased to see the employee resource groups in general kind of take off, because I think that can be a great way to kind of segue into people feeling more comfortable to report themselves as a family caregiver, because there's certainly this massive stigma around being a working caregiver and being upfront with that, and maybe missing out on opportunities or having some types of prejudices, taken against you for that. And the ERG, I think, can collectively as a community kind of bridge that gap. Which is why these HR leaders were talking about the ERGs kind of growing and establishing, to give people the space in the community to share and learn from their peers.
Thank you, Elizabeth. Thank you, Consuela. Kimberly, do we have any question at this point from the audience?
None yet. I'm watching chat and LinkedIn.
Great, thank you. So let's move on. Now after that, we wanted to see, well, you recognize that part of your workforce. Sometimes they were telling us almost 75 to 80%, which we find it quite large, were part of family caregivers within their workforce. So we asked them, what do you see is the impact within your organization if you're not supporting your working family caregivers? So Zach and Scott, can you tell us what we found from the HR leaders and your own experiences working with and supporting family caregivers?
Yeah, absolutely. I'll start with the buy-in, if you will, from the human resource experts that joined the roundtable, if you will. There's a really high agreement that the biggest impact that can occur, the biggest risk, if you will, is attrition that can result from being an employee caregiver. Now, as Paula indicated, right now about 73% of employees are estimated to have some type of caregiving responsibility, which is leading to higher attrition rates. Now, statistically, that's been hard to gauge for a number of reasons, one of which employee caregivers are pretty quiet about being a caregiver. They don't often share to their employees. So when they do quit, there's not necessarily a solid reason provided. But right now, the number of employee caregivers that quit range anywhere percent on the lower end, possibly as high as 30% that do end up leaving early, retiring early, or just quitting. The impact on the organizations are pretty comprehensive. Rehiring, having to retrain during that transition to finding someone new, the teams have to maybe step up, share the work of the person that left. So their, productivity may be dropping a little bit. Cost of retraining, impacts on customer relationships, could be hitting company morale, always recruitment challenges, and some impacts on organizations' reputations as well. One thing I want to touch on is the need to recognize that this issue is going to impact all generations. We'll talk more about this, but the caregiving, you've got the vertical support for women in leadership, LGBTQ, but caregiving is going to be the horizontal aspect that cuts across all of this. So when you talk about wanting to support those vertical groups and you have caregiving impacting 73% of your employees, that lawnmower of caregiving is going to come vertical across the company. And it's just going to impact everybody. So quickly, disengagement and reduced productivity are also ways that caregiving impacts companies. Presenteeism, often called the distraction factor, a lack of focus, attention to detail. When a caregiver is coming in with having to schedule doctor's appointments, trying to make doctor's appointments during the day, all of those tasks that can only be accomplished during work hours nowadays, it's hard to maintain always that level of focus that they had prior to becoming caregivers. Average loss of work based on that aspect is about 11% of their hourly rate. Productivity loss per working caregiver is about $5,300 a year. There's an average of a little more than 3 days missed work days per month by employee caregivers. Absenteeism comes into play, about $1,100 per year. So if you're thinking about all these costs, just start thinking about the number of employees you have. 73% of those are acting in some caregiving capacity, and then 10 to 30% are going to quit, and then you can just start plugging in numbers. What's our average replacement cost to rehire or retrain? You can see pretty quickly that all this gets into some pretty costly aspects.
Scott, thank you, man. I also want to do a shout out to all the focus members. I'm a former HR guy. I'm Zach Mopoulos, and I really appreciated, like you, Chris, I've waited a long time to see HR leaders sitting around the table and be a little vulnerable and talk a little bit about their own caregiving responsibilities as well as what's being impacted in their organizations. I was thrilled to death as Kimberly and I and Paula kind of helped facilitate that discussion. I was really impressed, and thank you to all the HR leaders that have validated and have brought more to the table. A couple more things that they shared that I also want to tag on what Scott was saying to answer your question, Paula, is there are some hidden costs, right? So as an HR leader, that used to frustrate us because a leader would say, how much is this going to cost us? And some of the focus members shared with us that some of these costs aren't something you can add up dollars and cents. Some of it is going to impact, let's say, your reputation, or it can impact your ability to recruit. I even really appreciated a HR leader who spoke up from the healthcare industry. And he said this actually can even impact patient outcomes and satisfaction. And so it could take a pretty costly toll on an organization. Organizations want to be competitive, and it's not just necessarily offering the best pay. What was shared with us is that benefits are also very important. Flexibility is also very important. And, you hear about these lists like the Fortune Best 100 to work for, or best workplaces for millennials and women and parents. Organizations want to be the best workplace. So they certainly recognize that this can impact their reputation. Lastly, I do want to say that there's some positive things here, and there's some good news here. And that is, it was shared with us that caregivers, if you retain them and they're able to work flexible work schedules and benefit from your perks, they actually tend to be some of your best employees. And all of us here on this panel and some of the focus group members can all attest to this, that if you can actually project manage between physician appointments, what to get for the grocery store, is mom or dad, his insurance bill is on time, how am I going to spend 6 hours here and still get a deadline met? And if you're able to do all that, you've got some skills. And that was recognized too by the focus group, that some of these employees who can handle these multitasks tend to be your best employees. So really appreciated those comments as well.
Thank you, Scott. Thank you, Zach. That was very powerful, as Sue commented on the chat. Really was an extremely positive comment from the HR leaders when we were interviewing them. And also other aspect that we found is that, and I think Consuela mentioned that at the beginning, if they have if managers, top managers have their experience, their own experience as family caregiver, that triggers down to the whole organization. And when they are more vulnerable and they have town hall meetings where VP level executives share their own experience, that changed the dynamic and the communication. We spoke about that, and that leads to the next question. We ask our HR leaders, do you have what policies, what employee benefits, what are your practices within your organization? Do you have anyone in place that you can share with us, supporting in a meaningful way family caregivers? Christy and Robin, would you like to share what we learned from the HR leaders, please?
Thanks, Paula. Yeah, this was really interesting. So we did ask the focus group members, what did they have in place and what benefits and policies were there and that they felt were supporting or were hearing were supportive. And some of the things that people spoke about were things like remote work, which is a little lesson we learned in a big time through the pandemic. But remote work is helpful for some folks. Flexible scheduling, definitely the employee resource groups, those ERGs, being something that's becoming more popular and supporting folks. Family leave policies. They also mentioned things like providing some health advocacy, transition to part-time, job sharing, just different kinds of creative ways to support people who may need time away from their workplace. And one thing that came up was a couple of people talking about equity audits, looking at, are we supporting our caregivers? And couple folks, couple HR leaders talked about, they wanted to look at, was that across the board? Were they looking at all different levels that were getting the support they needed? And also across states, there may be different kinds of benefits allowable, paid benefits allowable in different states. And so one HR leader talked about, let's look at that and let's see if we can find the most generous state where we're working and replicate that in other places by providing some paid care. And so that was another thing that came up, was the limits of the Family Medical Leave Act. That is a federal act that allows people to take some time away, but it's not paid. But the federal statute doesn't say you must pay people for this. And so companies are talking about, again, in the equity lens, how can we do this? How can we provide some support to people? So those were some of the things that came up. I thought that was pretty interesting. And I'm going to turn it over to Robin, who's going to talk to you a little bit about educating leaders.
Great. Thanks, Christy. Yeah, one of the questions we wanted to know when we were talking with these HR professionals was, what sort of things are you doing to allow your managers and your executives to actually talk with the caregivers and their employee? And one HR executive said the training is lacking for managers. She said a lot of the work that we've done has been in the mental health space. And a lot of companies are very, very concerned about mental health and well-being, so they tend to direct people to that and funnel them into that category. When what family caregivers really need is a conversation, is to be able to talk about their caregiving role at home, how that's affecting them at work. And caregiving has been a silent topic. So one of the things that they stressed as really critical is to provide training to the managers that are leading the teams that hold the caregivers within them. Those trainings are enhanced communications. How do you actually talk to a caregiver if you're not one yourself? What are the questions that you can ask them? And what is the level of conversation that you should be having with those people in order to identify what their needs are? As already pointed out here by some of the others on our focus group, there are a lot of interruptions when you're a family caregiver. The phone rings, your parents in the ER, you got to drop everything and run. When you're caring for children, it's easy to talk about, my kid broke his arm at a baseball game, I got to go. But when it's an 85-year-old parent who's had a fall and broken a hip, you just say, hey, my parent's in the ER, I got to go. So having some communication trainings, awareness trainings with those managers as to, again, back to identifying who those caregivers are in their employee. And as also mentioned here, normalizing the conversation, opening up the channels of conversation from the executive level all the way throughout the organization. And that can happen through town halls, as someone mentioned. It could happen through the intranet at the company. It could happen through newsletters. It can happen through the ERGs. Perhaps the ERG person in charge comes to town hall and presents what their findings are or what their group is like. And there are new employees in the organizations who are caregivers who are like, oh, I want to join this. So the internal communication channel is really important as well. And one of the things that we learned some employers are doing are offering trainings to their managers by caregiving experts. So communications, how do you talk to caregivers? What kind of questions do you ask them? How do you determine how to support them best in their job so they're not walking out the door? Something they prefer not to do, actually. And how do you guide them to the HR benefits that are actually in place that could support them? Because there are many HR benefits already in place that can support those family caregivers. And a lot of those caregivers don't know what's there that would help them.
Thank you very much, Christian, Robin. And I want to repeat what Robin just said. Number one is to educate the managers at any level in order that they can spot the family caregivers, because family caregivers themselves, and that is something that we heard from the discussion, they don't label themselves as family caregivers. I just happen to care for my mom. I just happen to care for my disabled child. I just happen to start doing the groceries for my father, or I just happen to be taking care of all his finances, but I don't call myself family caregiver, which is what I'm doing. So for the managers to, first of all, be knowledgeable, to identify what they are, how to spot those family caregivers, what is the load and what are the needs, and educate them on the resources, because we had the experience from one of the HR panel, HR leaders that we interview. They told us, we have a wonderful system at this organization, but this is such a huge organization that everything is in silos. So one benefits belong to one organization, another benefits belong to another. So then it's very cumbersome for any employee to really access to those resources that are available. So education, training, sharing the information, and normalizing the discussion. Now that we're talking so much about, and rightly so, talking about mental health, we also have to talk and normalize family caregivers, because as Scott pointed out also, family caregivers many times don't mention the difficulties that they have, in fear that they are not going to get that promotion, they are not going to go to the next level. And many family caregivers, especially if you're caring for an older parent, it would happen that you are at the peak of your career. You don't want to miss that promotion, and it's really a struggle. So at this point, I want to open the panel, the discussion. If there are any questions on the chat or any questions from the audience, Kimberly, can you share that with us, please?
Yeah, we have one question directed at Robin. Did you find any difference in employer acceptance of caregiving for a sick spouse as opposed to a parent?
That's a great question, Monica, and I can't say that I have a specific answer for you to that question. What I can share with you is that in meeting many working caregivers who are not sharing this, they just have interruptions to work. So it's hard to say, did an employer accept the fact that they had to abruptly leave work to go tend to a parent who's in the ER or a spouse that's in the ER? Because we didn't actually get into that particular question. I think it's a great question. And I think it also sort of aligns with the question of, is there sympathy for a parent who has to leave when a child gets sick at school? Yeah, you bet there is. Women have been fighting for childcare rights for years. So I would venture to say, I'm not sure there is a lot of sympathy for that caregiver who has to leave to go take care of a parent when no one knows what's going on, really. I do know that I've read research where companies have found that team members who don't know what's going on often get resentful of the interruptions. And so one of the things that managers can do with teams is open again that conversation so that when there is the interruption, those team members can step in and support that individual.
I'd like to, I'm going to dig in some more, Robin, with you, because I think what you're talking about is so incredibly important. I have talked to an HR leader who outside her own office heard an employee walking by that was on the phone. And so she heard the one-sided conversation, of course, of that person on the phone with their aging parent, and was like, Mom, it's okay. I'll get there as soon as I can. So she's hearing this kind of conversation, and she didn't approach her team member. Like, she just kind of like didn't know how to handle it. How could that have gone differently?
Are you asking me, Kimberly?
Yeah, because you're such an expert.
Yeah. Well, it's, caregiving for an elder parent is a sensitive topic, right? We come to work and we talk about, oh, my child's learning how to walk, or my child's finally gotten rid of the diapers. But we don't talk about our parents whose Depends we have to go to the store and buy. We don't talk about the fact that my parent has graduated to a rolling walker now instead of using her cane anymore. We don't talk about these things. They're very sensitive. And we as caregivers don't talk openly about them because nobody seems to understand or get it. And so part of that walking by is, I don't know what to say. I don't know how to engage with that. What do I ask her? Everything will be fine. No, everything won't be fine. My mother's 90 years old. She's sitting in the ER for the 4th time this month, So part of that goes back to the communication training. And so our HR focused people said, yes, we need to train our managers and our executives in how to have these conversations. And I think that training needs to go all the way through a whole team. That whole team needs to be educated. What is it to be a caregiver? What are the sorts of challenges that you face? What is it like when you have to go visit your parent in the hospital for the 5th time in a year? Open up the story about what it is like to be that individual in that role. Because in a way, it's almost like death. We don't talk about death very well. We just kind of walk by it like that. And until we know how to have the conversation, how to ask the questions, and how to pull up the empathy that's within each of us to talk to those individuals, even if it's just a quick comment. Hey, I heard you talking about this situation with your parent. Just want you to know I'm here. You want me to pick up an extra shift for you or pick up that client call for you? I can do it. And sometimes that's all the caregiver needs, is to know that there's somebody who may not understand the situation, but is there ready to help.
Can I make a comment?
Yes, please.
So, Robin, the reason why I asked that about grandparents is we're running into more situations where we have grandchildren taking care of grandparents, and there's a missing generation in between there. And so I think that this whole notion of trying to have the conversation, this whole dynamic has to change if it's going to work, because we're making these assumptions as we sit here today, that it's our parents. Well, it could be your grandparents.
Yes.
It could be an uncle who, an unmarried uncle who, no one's been looking after, and you're doing that. We have to find a way to make this normal, to have the pictures of all those people sitting on your desk as well. So they're part of the conversation. They're part of your life as it pertains to your work life, not just your kid that, in his baseball picture that year. No, what about the other people in your life as well? They may not be as charming as that young kid that's growing up and now, missing 2 front teeth, but they're still part of your life. And somehow we need to normalize that for people to be talking about that at work.
I totally agree with you, Monica. And I think it's such a great question that needs far more discussion. And I speak a lot to aging parents because that's my specialty and expertise with caregivers. So I don't mean to neglect all the other people that are being cared for as adults out there in the world. And there is this huge growing populations of people between the ages of 20 and 30 caring for grandparents now.
Right. Yeah.
Absolutely. Other questions, Kimberly?
Yeah, a question for Zach. Zach, thanks for sharing your perspectives as a former HR leader. Where else could someone go in their company to find some support? And I know that we had some HR leaders share different alternatives for caregiver support. So what are your ideas around that?
Yeah, sure. Thank you. I'd like to always just start by telling my quick story. I was drafted, and I use the word draft because it was totally involuntary, as a long distance caregiver for my father when he had a stroke and a 3-minute phone call. That was it. I became an instant caregiver. I'm in HR. I didn't even know where to go. I was kind of clueless, and somebody kind of said, hey, why don't you contact EAP? I'm like, I know we talk about EAP all the time, but I don't know really what it is. And so I had an introductory lesson in what EAP can do for you, and I found them somewhat helpful. Were they the answer? No, they weren't the answer. And I'm hoping 17 years later that there are better aspects of EAP. So my first response would be to go to EAP without a doubt and see what your company's already paying for and what kind of benefits they can assist you with, like maybe local home care assistance or placement services, or even elder care attorneys. They may have a list already brewing that they could share you with, which is a lot of homework, a lot of work to go out and find those on your own. The second person, which is not the most obvious, and we've kind of touched on that already, where we don't talk about things at work, but your leader, your manager, should be somebody that you ought to at least start having a conversation with about, you know how you always do, I have a friend and I'm asking for a friend. All right. So why don't you start with that? You know, you could say, I have a friend who's caring for their parent. Do you know if our company does anything for that? So I highly recommend that that at least start a conversation, you know, with your leader. The third thing I would also offer is that organizations like, you know, marketing departments or government departments, if your company has those, you know, there's so many different aspects to organizations may have access to information that they're just sitting on. For example, you know, I worked for Pfizer, and Pfizer had a huge government advocacy department, and they had the ins and outs of every local and state type of legislation that occurred. And they were actually great in pointing employees to local benefits that most people don't think about. I didn't learn about them until I started running a home care agency, but there are so many local benefits that your company could actually steer you in the right direction. Again, it all starts with conversations that you need to start having, which is what I hope we'll start doing more and more of, as we talked about this already. Like I said, nobody comes back to work and shows pictures of their dad's or mom's bed sores, or they talk about, you know, how bad that fall was when they fell. I want to do a shout out to my good friend Jen Chan. She wants to start something out there in the world called senior showers. You know how we have baby showers when somebody comes back to work? Well, why don't we have a senior shower where we celebrate somebody who now has a caregiver? You know, let's make it more normal. Like you said, Monica, I love that. We need to start normalizing some of these conversations. Now, that said, I did see a good comment from Sue. We do need to be careful as a former HR leader, and I know we've talked about this on our panel, but we do got to be careful about privacy and confidentiality. So, you know, obviously you don't want to ask questions that are going to pry into someone's privacy. So I would start off with more generalized type questions.
That's the double-edged sword, Zach. I mean,
no, that's the litigious country you live in. No, but seriously, Monica, it can be a double-edged sword, but until our care cultures in organizations are more sensitive, empathetic, and leaders, we already talked about this earlier, leaders have to be a little bit more equipped. We need to support leaders. It's easy to say, go talk to your leaders about caregiving. Somebody said this earlier, if you don't really have experienced grief, how can you counsel somebody on grief? So if you haven't experienced caregiving, so start with more general things like, hey, what'd you do this past weekend? And, you know, are you carrying, you know, I don't know, what does your weekends look like? What's your life look like when you go home? And let the employee choose what they decide to share, what they don't share.
I've been thinking about this whole, if I could jump in briefly, this whole act of how to normalize this, or how we've gotten to this point where it's kind of taboo to talk about things. And, you know, if you look at the statistics, where 73% of employees are acting in some level of caregiving for an aging family member, what else in your company is 73% going to have a commonality? That's pretty significant. So as I've been thinking about why it's hard to talk about, the only analogy I can come up with is there's this analogy that if you put a frog in warm water and you slowly turn up the heat, it's not going to recognize the additional heat because it's becoming normalized over time. As opposed if you threw it in cold water and suddenly turned up the heat. So I think that's where we are as a society in a workplace, is that it's just normal for family to take care of aging parents. And so we're all in that warm water where now the heat's getting turned up and we're not sure how to get out of that complacency. So that was the only analogy I could really think of. But so we have to think of some way to, I think, get a big bucket of cold water and throw it on the warm pool that we're in. So if anyone has ideas on that, I think that's really what we're all looking for, how to get us out of that complacency on it.
Thank you, Scott. Something else that I wanted to share from what we learn is the cultural differences. Latino communities, we don't think twice. It just belongs to our nature. We just care for our family. It's not a job. And I think other cultures play the same role. So recognizing that this is yet a new circumstance is hard to do. So that is also part of the difficulties that we are facing. Really asking families to identify the realities are different, and we need to have more resources for all the important reasons that you, Scott, and Zach, and everyone else in the panels have mentioned. So Kimberly, I think this discussion is going extremely well. All the questions.
Yeah, I think we had fabulous discussion, great questions. We need to wrap up to respect everyone's time. So this would be a great chance for you to have some closing remarks, and then we can kick it to Chris to share how people can access this beautiful white paper that was put together.
Thank you, Kimberly. Really, this was, as you can see, our energy. We are very excited and committed. It was a work that really we feel, I mean, after the year, we came together and we said, it has been a year of Mastermind, and do we want to continue? And everyone in the group shouted, yes, we want to continue doing more of this work. We really want to go deeper and touch every single of the points that we study and expand it to more. I mean, one of the areas that we really want to go deeper into what are the specific situations. We were just calling family caregivers in general, but there are different situations when you are caring for an older parent that have some chronic condition, or even when they are experiencing dementia. We have to bring that to the surface, that the different situations are different and the family caregivers react and face different challenges with the different situation. What's happening with veterans families? What are the resources? How are we aware? Mental health. So as you see, we really have a lot of topics to dig deeper, and we will do it as moving forward, and new outcomes of our investigation and research will come about with new updates to our white paper and more. But really the goal of all this work was for us to help raise awareness of how important it is to support family caregivers. As I mentioned at the beginning, the reality is we have a dual income or household. So being a family caregiver doesn't eliminate you the need to have that's both adults in the family needs to work, and why not? It's also part of your a sense of accomplishment. We really want to have a professional life. We have our individuals of multiple facets, and we develop ourselves in different areas. So having said that, very excited of the work that we all did. Thank you so much for my team members of working hard to complete this task, and we are committed to continue working. Thank you, Kimberly.
Want to tell them more about Whole Care Network and where they can get the white paper? I've put the links in the chat, but if you want to share some more.
The link for the chat, the link for the white paper is in the chat, and I must say what a great conversation today. And what I was thinking about as I was listening to everybody is there's just about a podcast for every topic that was talked about today on the Whole Care Network. I would encourage everybody, if you haven't been to the Whole Care Network, just go to our media section and you'll see our podcast landing page, whether it's The Heart of Hospice, Happy Healthy Caregiver, Untangling Dementia and Alzheimer's, We have a relationship with Coming Home Well, which is a veteran podcast. There's a story for everybody and a resource for everybody on the Whole Care Network. But the best part of the Whole Care Network is people like you who share your knowledge and expertise. Because it's the Whole Care Network, it's all care all the time. Thanks so much for being a part of this wonderful event today.
And I don't
Yes.
see an answer for yet. Is next steps from what we're gonna, is this is such a great beginning? What are the next steps? I'd love to support whatever you're doing in the future. Is there, and just keep building on this? Do you have plans for what you're gonna be doing next?
Yes, Sue, and you are welcome to join us in our mastermind. We are creating additional content and we are setting up the steps of what are the additional research that we're going to be doing. So happy to have you as part of our mastermind and anyone else that wants to join us.
Wonderful. We'll connect.
Sure.
This is awesome, you guys. This has just been really great. Thank you. Super happy.
I know
for
it's been said a few times, but I do want to thank Christopher and Kimberly and Paula, your leadership and initiative to put this together. Just to kind of answer Scott's question, this is the way. I don't know about the frog analogy, man, but this is the way to warm things up so we can start. You know, the white paper was truly designed. We have 1 million caregiver advocates across this country, and this helps businesses kind of understand, okay, there is an issue. We're slowly getting there. But thank you, Christopher, Kimberly, Paula, your leadership and everything for bringing it to today has been amazing. Very grateful.
Yep. Thanks, everybody.
Take care.
Thank you. Thank
well
you.
done, everyone.
All good.
Okay. You know what? This was awesome. Thank you so much, everybody.
Thank you. Thank you, Christy.